We're going to show you how it's done live and also dramatic results. I mean, we've got the proof and split screen coming up here shortly. It's called Thermage, and before the end of the show, you're going to see the difference it can make.
Also, there's a surprising Thermage, as it's known, or Thermage, as I keep calling it, offers something very different. The technique uses radio waves to help tighten the skin and eradicate facial lines, and the results can be quite dramatic. ABC News first featured this technology over a year ago, before it was even FDA approved. We followed 51-year-old Sharon Young as she went through the procedure.
I see the lines here and a bag here and wrinkles here and my eyes falling down.
The machine uses the heat and energy of radio waves passing through the skin to build collagen. Sags are lifted, wrinkles removed. Follow-up photos were taken 6 weeks later, and Sharon and her doctor noticed there were significant changes.
It was rather remarkable. There were some deeper lines around the eyes that have softened up, and there's been a little bit of lifting of your actual eyebrow itself. The definition of your jawline has improved quite dramatically.
And when our sister station in Washington, D.C., WJLA, had a patient undergo Thermage, their patient's results were instantaneous and, as you can see, quite dramatic.
That is incredible. I mean, really.
Yeah, it really is dramatic. I hope you're going to do the other side of the face now,
I was going to say, does she pay for the whole treatment, or does she just have half a face there?
We're going to go ahead and do the rest of the face now. We don't want Shelley looking odd.
Well, Kathleen Kornblatt is a 52-year-old woman hoping to look 5 years younger, and she's opted to have this cutting-edge, non-surgical procedure performed live this morning by cosmetic plastic surgeon Dr. Michelle Copeland. Michelle has written a book called Change Your Looks, Change Your Life, and they're joining us now from Dr. Copeland's operating room, which is on 5th Avenue here in Manhattan. And I understand this machine is somewhat noisy, but I think I can hear you. Let me start with you, Dr. Copeland. Tell me, when somebody comes into you and says, I want a procedure, I want to look a little bit younger, for whom would you recommend this procedure, and for whom would you recommend regular surgery?
Well, what's terrific about this procedure is that for the first time, we can actually lift, give a facelift without any blood, without any scarring. So for someone like Kathleen, who is starting to have the aging process with a little bit of sagging, this is an ideal procedure because she's going to get, without any downtime, a lifting of her skin.
Well, for whom would this not work, and you would recommend regular surgery?
Someone that has a lot of sagging, while they'll get an improvement, they won't get as much of an improvement as the more traditional kinds of surgical procedures. But still, even for someone like that, if they don't want any downtime, this will give them a lift.
So the changes are not quite as dramatic with this procedure?
That's right. They're not the same thing as a facelift, but we are moving towards the ability to give a lift without any surgery, and it's really quite remarkable. I'm going to start the procedure now, and you can see that I'm going to be giving these radio waves that are generate heat and bypass the skin. By doing that, it stimulates collagen in the deep tissues. And that collagen, which is immediately you'll see a lifting, and then over time you will continue to see an improvement in the tightening of the tissues, the deep tissues of the face.
Now, what's the difference between this and using radio waves and using lasers, which was a technique we'd heard about as well?
Yes, absolutely. Well, the traditional lasers caused a rawness of the skin and thereby caused a tightening. So you actually did have a downtime to that procedure.
Gotcha.
Then the new non-ablative lasers, of which we can also use that in combination with this, makes the skin tighter, but it does nothing to the deeper tissues that these do.
And how long does this last?
Well, what this does, the tightening that you get will last depending on how your skin ages. So the aging process goes on, but this causes a real change in the tissues of the skin.
Well, do people have to come back for subsequent treatments, I guess is what I'm asking?
Well, I think that over time, as you age, you certainly may want to have this done again. That's an option. Generally, they say about 18 months.
Ah, there's the answer. And can you give me a rough cost?
Depending on what section of the face is done. Today we're doing Kathleen's whole face, but you might just have your forehead done or your neck done. So anywhere from $1,800 to several thousand.
Now you say we're going to.
Of course.
I'm sorry. Go ahead.
No, and that's of course a fraction of what a facelift would cost.
Sure. You mentioned that you're doing Kathleen's whole face, but for purposes of what we're going to see in our next half hour, just in the piece we did there, we saw a rather dramatic case where at first just half of the woman's face had been done so that you could see a rather dramatic comparison between new and old. You're going to do Kathleen's whole face eventually, but are we going to just do a half hour or a half of the face and show it in our next half hour?
Yes, we are, and you're going to see, even as I'm doing it, I can see the tightening taking effect as I'm giving these impulses.
All right, Dr. Copeland, appreciate it. Thanks very much. We'll be back with that in our 8:30 half hour, and you can see how Kathleen Kornblatt came out, at least half of the face, and then, as we say, the other half of the face to be done after the program is off the air. Thermage is the name of the procedure. You can find out more about it at abcnews.com. And when we come back, the star of Alias, Michael Vardu, procedure called Thermage, but cutting edge is really probably not the term we ought to use because no surgery is involved. It is a facelift using radio waves to penetrate and rejuvenate the skin, and we're going to do just in this hour just half the face, so you'll get some sense of what the results are, and then after we're off the air, if she's very nice, then they'll do the other one side of the patient's face. It is called Thermage and utilizes radio waves, as we were saying in the last half hour, to penetrate the skin and rejuvenate the collagen, the natural collagen that is in a woman's face. So once again, from her operating room on Fifth Avenue in Manhattan is cosmetic plastic surgeon Dr. Michelle Copeland and her patient Kathleen Kornblatt. And doctor, you should give us some sense. Now, what you operated on was just the left side of her face, or screen right, as we're looking at it.
Exactly, and you can see here already there's a lifting effect immediately in this region here in the eyes as you compare it to the other side and along the jowl area. So this is the immediate result, and then over the next 3 months she's even going to get more improvement.
Now, can you turn Kathleen slightly? Well, you're doing it now. That's right. Turning her slightly to profile so that we can see the changes there.
Right. There's a very nice lifting around the eyes in the cheek region and also in the jowl region, in the neck as well. And then here in the eyes, there's a nice upward lift here. It's like doing a forehead lift without any of the incisions and with no blood.
And have her turn, if you would, slightly profile to the other side so we can see in effect the before.
So you can see over here this downward drift that occurs with aging has now on the other side been eliminated.
Now, Kathleen, we shouldn't be talking about you as if you're not here, which you're very much a part of all this. Can you feel any difference on the left side of your face or screen right as opposed to the other side?
No, I really can't feel anything.
It doesn't feel tighter, or it doesn't, there's no pain involved, or?
Not really. Too soon to tell, I guess. When I touch it a little bit, it feels a little different.
And have you gotten a look at this yourself? Because we can all see it, but have you gotten a look at it yourself?
No, I haven't.
Well, I don't want you to have to wait for the videotape. I'd hope somebody could hold up a mirror there or something that you could see what's done.
Well, we're going to actually be doing that. She's going to have a mirror and she'll be able to see it. It's very exciting when they can actually see the difference.
Now,
it makes it all worthwhile.
Now, I was just curious, when you were talking to me in the previous half hour, I kept being worried because you were looking at me while you were carrying out the procedure, and I kept thinking, gee, I hope nothing goes wrong with you. You know, it's like a driver looking at the passenger next to them. But it's okay, right?
Well, actually, as I place the handpiece, I'm looking at her, and that's very carefully placed. Then as the radio waves go on, I have to hold it in a steady position, but I can talk to you at the same time.
I got you. Okay.
That's how that's done.
All right. Well, Dr. Copeland, thanks very much. I know you've got to the other half of this procedure to go, and Kathleen, I appreciate you being with us. When they finally get a mirror to you, I hope you're most pleased.
Yes, thank you.
All right, take care. It is interesting. A facelift in effect, or cosmetic surgery, not really surgery, all done with radio waves. Thermage is the name of it, and as we mentioned, you get details on it at abcnews.com, and we'll be back.